Donate Life Month is an opportunity to highlight the wonders of organ donation and the need for organ donation. Right now in this country, there are over 120,000 patients waiting for life-saving donated organs. Those are hearts, lung, liver, kidney, pancreas. We have 18 patients a day who die on the waiting list across the country waiting for donated organs. So Donate Life Month is both an opportunity to thank those living donors who've decided to donate a kidney or a liver, and families of deceased donors who've donated solid organs as well as blood and marrow and tissue that have saved lives. One donor can save 50 lives. Well, one myth we hear is that patients feel if they're organ donors, perhaps when they come in with an emergency medical problem, they won't be resuscitated or saved because people would hope they'd become organ donors. Clearly, that's not true. When a patient comes in with a crisis, whether they've had trauma or a bleed in their head or the sorts of things that cause them to be organ donors, physicians, emergency staff work tirelessly to restore that patient to good health. But if they do progress to brain death and they have the opportunity to become an organ donor, I believe it's an opportunity to take a very bad, tragic situation and infuse something good. Something good comes of an otherwise complete tragedy. And families tell me that time and time again, that when their loved one became an organ donor, they were able to see some good from this terribly sad event. There is a great deal of misunderstanding about religions. Most major religions believe that organ donation is not only acceptable, but to be encouraged. And that's the religion, the Christianity, Judaism, Hinduism, all have support for organ donation. Now, some sects in individual religions have their own particular beliefs, and I encourage patients and individuals who are thinking about organ donation to talk to their clergy and understand where their religious beliefs are rooted. One of the myths is that patients believe maybe I'm too old or too sick to be an organ donor. The truth is that only at the time of brain death can one assess whether organs would be useful or not. And in many situations, people live to a ripe old age precisely because they have good, healthy organs. They may die from a problem with one organ, but they may have a good kidney or good liver and could be organ donors. So I encourage patients and family members not to count themselves out. Let the professional evaluate the situation if they're in a situation where organ donation is a consideration. There are over 120,000 patients waiting for organs, life-saving organs. Because of that, we look seriously at every donor offer that becomes available. And we don't, at Mayo Clinic, we don't count out a donor simply because of age or other conditions. We look at the individual donor, their medical situation, and what their organ function is like. And in fact, we've been able to bring many patients through successful transplantation with older donors or non-traditional donors because we're very careful about evaluating those individual donors. But when you're careful, oftentimes you can use organs that you might otherwise have dismissed as not appropriate.